Hello, everyone. Welcome to this edition of Vet Talks. I'm Dr. Lauren Smith. I'm a small animal veterinarian in New York, and I'm the creator of the Vetitude, a veterinary brand dedicated to promoting empathy and teaching emotional intelligence skills needed to thrive in the fields of veterinary medicine. Today, we're going to be discussing trust within the veterinarian-client relationship. In this presentation, we're going to address why it's important for us to gain our clients' trust. We're going to talk about some of the physiology involved in trust. We're going to talk about the 4 fundamentals of trust. Those are the qualities or traits that we use to determine if someone is trustworthy or not. And finally, we're going to talk about how to communicate our trustworthiness. So why do we need trust? I think most of us have days where we wish veterinary medicine were like this photo, a cute animal with a faceless owner. But we can't just cut the client out of the picture. That's not how veterinary medicine works. People are a huge part of what we do, and if we ignore them, it's going to make our jobs much harder and less rewarding. Trust has tangible benefits in the business and medical aspects of our jobs. For starters, improved trust increases efficiency and decreased costs. The more clients trust us, the more likely they are to come to us early when conditions are more easily treated. They're more likely to heed preventative care recommendations, which can prevent costly and debilitating illnesses, and we're less likely to have to practice defensive medicine. Trust also increases compliance. If our clients trust us, they're more likely to agree to our recommendations for diagnostics and treatments, and they're more likely to follow up with home care. Like if you have a dog that you've treated for heartworm, if the client doesn't really trust you, they may think that you're exaggerating the risks of being active and they may not crate rest their pet. But if they trust you, they're going to believe that what you tell them is important and they're going to be more likely to follow through with it. And increased trust decreases defensiveness and blame, especially when we have an outcome that maybe isn't as positive as we would like. People don't typically leave terrible online reviews for people they like and trust, nor do they tend to take out lawsuits or board complaints. The risk of these kinds of outcomes are far more linked to the rapport that we have with our clients than it is to the medicine that we practice. So, trust is important, and our ability to trust is significantly affected by our brain chemistry. Yes, our actions are paramount in building trust, and we're going to get to that. But in order to be open to trust, the brain needs to be in the right frame of mind. And there are 2 hormones in particular that affect our ability to form trust. One works with us, and the other one works against us. First, we have cortisol. Cortisol decreases trust. It activates the amygdala, which is the fear center of the brain. That's the part of the brain that responds to threats, and it puts us in fight or flight mode. Our clients are likely high in cortisol when they come to us. They're bringing you a sick pet, or they're entrusting you with the care of the livestock that they base their livelihood on. They're generally in a vulnerable position, and that makes them worried about being taken advantage of. So right off the bat, we have that going against us. But there's another hormone, oxytocin. Oxytocin increases trust, and it's often known as the bonding hormone or the love hormone. It's what a mother's brain releases during birth and nursing. It's released during sex, but it's also involved in platonic bonding too. Oxytocin activates the neocortex, which is the area of higher functioning in our brain. That means that in addition to helping us bond directly, it improves our analytical and verbal ability. And that means it makes it easier for us to communicate effectively with our clients. Oxytocin and cortisol can be present together, and oxytocin has been shown to mitigate the effects of cortisol. So one of the most powerful things we can do is find ways to increase levels of oxytocin in our clients. So what are some of the ways that we can do that? One of the most effective ways to stimulate oxytocin release is with physical touch. How much physical touch is appropriate is going to depend on your culture, your comfort level with physical contact, your evaluation of the client. But try to find ways to initiate contact, even if it's just a handshake. And we don't just need to rely on physical contact with us. Physical contact with our pets can release oxytocin for us and for them. So if we let people stay with their pets as much as possible, that is really going to be helpful because it's going to allow people to pet their animals, hold their animals, and that's going to release oxytocin, which is going to be relaxing and comforting for them as well as for their pets who are going to have increased oxytocin in the presence of their owners. And we can also use the physical environment to our benefit. Playing relaxing music can stimulate oxytocin, and studies have also shown that we release more oxytocin in warmer environments. So we want to make sure that the temperature is one that is safe and comfortable for our patients, but just raising the temperature a couple of degrees in the client-centered areas of the clinic, like the waiting room, can help prime them to release more oxytocin and be in a more open place to trust us. And we, of course, want to pay attention to our clients. Eye contact is really important and is essential in stimulating oxytocin release. But trust isn't just a series of chemical interactions. Those help make us open to trusting, but ultimately, trust is based on assessment of certain qualities. Those qualities are known as the 4 fundamentals of trust. They're an evaluation of our character as well as our competence. And the 4 fundamentals are capability, reliability, integrity, and empathy. Capability is about what we can do. It's about our level of knowledge and skills. Most clients come to us with the belief or understanding that we're capable. They came to us for our knowledge and skills, so this one's usually pretty easy for us to have. But it's important that we not abuse that belief in clients, and that means that we need to be aware of our own limitations and know and be able to admit when something is over our heads. So we might need to tell someone that we can't help them and refer them to a colleague, to a specialist, to another facility. And another aspect of capability, in addition to knowledge and skills, is our resources. So I have the knowledge and the skills to perform a splenectomy. But if I'm at a general practice that doesn't have blood products and the patient already has a hemoabdomen and is anemic and needs a blood transfusion, I don't have the resources. So I'm not capable of performing that procedure at that time for that client. And we need to be able to admit that. The next factor is reliability. Reliability is your ability to meet your commitments. And when your clients evaluate your reliability, they're evaluating things like your availability. Are you there for them when they need you? We can't be available 100% of the time, so what provisions have we made for our clients when we're not there? Is there an on-call doctor? Do we refer them to an emergency clinic? Do we provide them with access to a teletriage line where they can talk to a doctor? The more alternatives we can give them, the better too, because a lot of times, for example, a client will call the clinic and they may get a message that says, if this is an emergency, contact the emergency clinic. But maybe the client doesn't know if it's an emergency, and now they feel let down because they're in this position of still not knowing what to do. Do I take the animal to the emergency clinic or not? So providing them with something like the teletriage can give them an alternative resource that helps make them feel like you've provided them with something to meet their needs, even when you're not there. The other big aspect of reliability is our ability to keep our promises. So we need to be aware of the promises that we make because it's hard to keep promises in veterinary medicine. Emergencies happen and patients take unexpected turns. So never make a promise you can't keep, and never promise someone that their animal is going to be okay because you can't foresee the future. But even if we don't make outright promises, we can still run into trouble here because people often perceive promises even if you didn't intend to make them. And they can have certain expectations, which, if not met, can be interpreted as a breach of promise. So we also need to be aware that we're setting realistic expectations. If you hospitalize a patient, for example, you want to be sure to tell the client when and how often to expect an update. Because if you say something like, I'll call you later with an update, what does that mean? Maybe that means to you, you're going to call them in 8 hours at the end of the day. And to them, it may mean that they're expecting an update in an hour or two. And if they don't get an update for the whole day, they're going to feel like you breached their trust. So we want to make sure that we're explicit in setting expectations. Next, we have integrity. That's the one most of us think of when we think of trust. Does this person have integrity? Are they honest? Honesty is an integral part in trust. We need to be open and honest with our clients, and we need to make sure that we're giving them all the information, that we are fully disclosing everything that they need to know in order to be able to make informed decisions about their pet's care. The other part of integrity that's really important is authenticity. We want to make sure that our actions are aligning with our words and that they're aligning with our values. If you're doing things that go against your values in order to please a client, it's going to backfire. People can see when you're being inauthentic, and it undermines their trust in you. They don't know what to believe about you. If you're willing to bend some of the rules, where do you draw the line? And lastly, integrity means being open. Being open to advice and opinions from others, being open to new ideas, being open to criticism. If you're high in integrity, it means that you are self-aware and you know that you don't have all the answers and you can admit when you're wrong and that you're open to learning and growing. And lastly, we have empathy, which is the most important of the four fundamentals, because people don't care how much you know until they know how much you care. If they don't believe that you have a genuine interest in helping them and their pet, and they don't believe that you genuinely care, they may trust you conditionally out of necessity, but they're always going to question your motives, and they will take that trust away as soon as another alternative comes around. And so we need to make sure that we are always exhibiting and being empathetic. We want to be empathetic towards our patient, and I think that's the easy part for most of us. Most of us went into this profession because we care about and want to help animals. It can be a little bit harder to show empathy towards the client, but it's just as important. And I know clients can be difficult, and that can make this hard when clients are being argumentative or just even downright mean sometimes. But we need to find a way to put ourselves in their shoes and see things from their perspective. If they're being abusive or mistreating you, you don't have to put up with that, but you do want to make sure that you're doing your best to see where they're coming from so that you can connect with that client on their level and create a rapport with them. And lastly, we need to be empathetic towards our staff and towards just other people around us in general, in large part because it's just the right thing to do to be kind and compassionate, but also because people see how we treat others. And if our clients see us mistreating our staff or talking down to them or belittling them, they, for good reason, are going to assume that that is who we are and that's how we're going to treat them. And that's going to undermine their trust in us. I think most of us are pretty trustworthy people. Veterinarians are far and away some of the most empathetic people I know. We're all really smart, too, to have gotten this far. And you may call me an optimist, but I really believe that people are striving to be truthful as much as possible and to honor their commitments. So if we're all doing so well with all four aspects of trust, why do we still have so many clients who seem to not trust us? Because it's not about whether or not we are trustworthy, it's about whether or not the client perceives us as trustworthy. So that means that we don't just need to be capable, reliable, honest, and empathetic. It means that we need to communicate those traits to our clients. And we communicate in a lot of different ways. The words that we use, but also how we use those words. It's how we say it. So if we want to communicate empathy, then we need to speak slowly. We're going to use a lower pitch of voice. We're going to use a quieter voice. And we also want to be watching our body language. We want to use open postures. It can help to mirror the gestures of a client to make them feel like we're on the same page. And we have facial expressions as well. And people aren't just noticing the active facial expressions that we're controlling. People can read our little micro expressions on our face, and that tells them a lot about us, even without realizing it. And the two aspects of communication that I think are really often overlooked are listening. We want to listen to our clients because communication is a two-way street, and we should be spending more than half of our time listening. We should be listening more than we're speaking because we want to show our clients that we're interested in what they have to say and what they think is going on. And we don't just want to listen, but we really want to pay attention. And that means that we need to work on our presence. We need to be present in the moment because people can tell when you're paying attention to them and they can tell when your mind is wandering. When you're talking to a client and then you stop to let them talk, you don't just want to passively listen. You really need to be focusing in on them and paying attention to what they're saying and not thinking about your differential list or what you want to say next. That's not the time to be worrying about what happened with your last patient or contemplating what's going to walk in the clinic doors next. You want to focus, be present, and be in that moment with that client. So, how can we do all of these things at once? How can you be thinking about your body language and your tone of voice and your facial expressions while being present and focusing and listening to the client? You can't. But the reason we associate certain body positions and facial expressions and voices with caring and empathy is because that's what our bodies and faces and voices naturally do when we care. So if we're not communicating what we're feeling, it's because other feelings and concerns are getting in the way. So if we want to be able to communicate empathy, one of the most important things that we can do is to relax. By relaxing, it allows us to be fully present in that moment, and it stops our muscles from tensing up and affecting our gestures, our facial muscles, our throat muscles. Of course, relaxing is easier said than done, especially in our profession where we're often dealing with really high stakes things, so it's something that we need to practice. So some things that we can do to help us relax is learn how to compartmentalize. We need to practice turning off what just occurred and focusing on our current patient and client. So sometimes that means if you've gotten out of a really difficult appointment that you may need to take a few minutes to process what just happened and to reroute your focus. Sometimes something like a mantra, a saying that you say, or some physical movement like putting your stethoscope over your neck, if you do that every time, can start to signal to your brain that you are moving on, and it can help you transition from one appointment to the next. We also want to practice relaxation techniques so that when we find ourselves getting tense and losing our focus, we can practice breathing exercises or muscle relaxation techniques to bring us back into the moment and help us relax. And we need to take care of ourselves. That means getting enough sleep, getting enough exercise, and having a healthy diet. Because if you are not healthy and you're not feeling well, you're not going to be able to concentrate. And we want to be able to have fun at work. You should be able to joke around with your colleagues. You should be able to sing or dance, or maybe that's just me. That's how I let loose. But however you let loose and relax, you should be able to do those, feel comfortable doing those things for the most part at work. You want to cultivate good employee culture too. Because if you're not comfortable in the environment where you're working, if you dread going to work every day, you're never going to be able to relax. Petting an animal. We discussed earlier how petting an animal can release oxytocin, and that works for us just as well as it works for our clients. And fortunately, most of us are going to be in jobs where we are often surrounded by animals, so that's a pretty easy one for a lot of us to do. And we want to be confident. This is the hard one because self-doubt is normal. And my best advice to you is to be confident not only in what you know, but also in what you don't know. And what I mean by that is that you need to be able to get comfortable saying things like, I don't know, but I'll find out for you. Because once you get comfortable saying that, then you can stop worrying about not having all the answers. Because no one has all the answers. And that's normal. So thank you for listening to this talk, and I hope you were able to take away some useful information to help you build a more trusting relationship with your clients.